Hi everyone, today we're going to discuss what we have determined to be best practice when it comes to managing post-operative pain in a pediatric population. Each year, 1.5 million children have surgery, and many receive inadequate pain relief, and in 20% of cases, the pain becomes chronic. With startling statistics such as these, we knew there was a definite need for research.
The studies we have chosen were conducted due to the overall issue of undertreatment of pediatric pain. The studies address the importance of a proper pain assessment, the most current medications and their efficacy, issues regarding side effects, and non-pharmacologic treatment options.
Pain is very tricky because unfortunately pain, it's not like blood pressure. I can't just measure it like I do with high blood pressure. I measure someone's pressure, I know that their blood pressure is high. Pain is really dependent upon what the patient tells us.
That's what makes diagnosing pain in infants and young children a challenge. They can't verbally express what they're feeling. Dr. Stork says there are more subtle signs you can use to identify pain.
Facial expression, movement of arms and legs, overall body movements, those are all behavioral aspects that tell us about pain. We also look at physiologic aspects. We look at blood pressure, heart rate, breathing rate. If the child's breathing very, very quickly, that helps to tell us that it's pain. And we put all of those together and come out with scores that help us to tell how bad the pain is.
As a result of undertreated pain, children can experience symptoms of sleep disturbance, behavioral changes, vomiting, slower wound healing, needle phobia, hyperesthesia, fear of medical procedures, and chronic pain.
As mentioned in the video clip, measuring the severity of pain and pain evaluation is challenging with children and can be problematic in that they are unable to express, verbalize, or exactly determine the location and severity of pain. This has resulted in an increase in pediatric patients with undertreated pain. Inadequate pain assessment is the foundation to treating pain, and therefore us as nurses need to be educated on assessment tools geared towards their age and developmental stage. A few examples are FLAC, a numeric scale, Quest, Oucher, and the Wong-Baker Faces Pain Scale. These, in combination with other resources, will help nurses in accurately assessing pain and will help them to treat it accordingly.
The use of continuous local anesthetic wound infusion, or CLAWI, with intravenous paracetamol, which is the British equivalent to acetaminophen, and rescue intravenous morphine was found to be very effective in treating post-operative pain from an open abdominal surgery in the pediatric population.
This involves placing a flexible, multi-hold catheter inside or alongside the surgical wound to evenly dispense the local anesthetic directly onto the wound area. Compared to the standard post-operative analgesia, intravenous morphine and paracetamol, and epidural analgesia, plus paracetamol and rescue intravenous morphine, the continuous local anesthetic wound infusion results in lower pain scores and relies less on the rescue opioid. Although this is relatively new for pediatric patients, use in the adult population has shown positive results. The current methods for post-operative pain management are prone to complications, contraindications, and side effects, so this alternative tries to move away from that.
Opioids are considered the gold standard for treating pain. However, opioids are associated with many side effects, many of which are frightening for both healthcare staff and patients. The severity of these side effects drives the need for further research for alternatives to opioid medications. Research shows that the concurrent use of acetaminophen with ketorolac resulted in fentanyl-sparing effects as well as optimal post-op pain management.
Research shows that small outpatient procedures are associated with the highest incidences of pain. Managing this pain effectively can be the difference between a lifelong battle with chronic pain and achieving expected healing milestones. In respect to opioid use at home, there is a sense of fear coming from parents surrounding the use of morphine in an at-home setting, without ready access to medical staff and monitoring. Ibuprofen is a medication commonly used by adults and therefore provides parents with a sense of comfort and familiarity, lessening the anxiety that they may feel. For this reason, along with how it managed postoperative pain, ibuprofen was determined to be superior for use in an at-home setting.
Pharmacological options are beneficial, but non-pharmacological options provide a more holistic approach to treating pain. For non-pharmacological options, best practice would be to include play into the postoperative treatment plan in order to distract and comfort children. Play is more effective when parents are involved, which is beneficial to nursing staff because nurses are not obligated to carry out this task. As well, it gives parents the opportunity to shine amongst the care of their child.
So what have we learned today? Let's review. The key aspect to pain management is a pain assessment. A proper pain assessment can be tricky in children, so make sure to use the tools you have. The use of Clawi results in lower pain scores with less use of rescue morphine. Ibuprofen is the preferred medication for use at home after small outpatient procedures. Using a combination of ketorolac and acetaminophen results in less opioid-related side effects. And lastly, involving parents with non-pharmacological treatment options, such as play, can not only make them feel involved in their child's care, but also ensures that during busy times, the most is being done to manage their child's pain.
Using up-to-date research and evidence-based practice is important, as new methods of pain management, whether that be non-pharmacologic or medication-centered, are readily being discovered. This can greatly inform the way that we care for clients and impacts their overall hospital and healing experience.
Pediatric pain should be taken seriously and is not something to be overlooked or undertreated. The general consensus among research articles was that a standard of care needs to be established and implemented among all pediatric care facilities.